My name is Karen Whitney. I'm a physician assistant. I graduated as a PA in 1976 and worked in primary care, internal medicine, and women's health until about 1997. At that point, I really accidentally got into the non-surgical cosmetic field and have been treating leg veins and doing treatment devices such as lasers and intense pulse light since that time. I came to Advanced Cosmetic Surgery and Laser Center to join Dr. John Mendelsohn and Dr. Joel Meyer. I'm thrilled to be a part of a complete surgical practice. My specialty here is anything that involves needles and treatment devices. So I perform Botox, facial fillers, I treat leg veins, and also assess for medical vein issues, and do the treatment devices, which include lasers, IPL, tattoo removal, mirror dry for sweating, and cool sculpting for fat reduction. I started doing sclerotherapy to treat leg veins as early as 1997, and estimate I've probably injected 3 million leg veins since that time. It would seem like it gets very repetitive, but each vein and each patient is a little bit different. The gold standard for treating surface leg veins is sclerotherapy. It's kind of a funny name, but it means to sclerose or shut down an unwanted surface vein. Patients commonly ask, don't I need these veins? And the answer is no. Really, any vein that you can see on the surface is pretty much dispensable. That's why we're not covered with veins all over. What we do is use a very tiny needle, inject an irritating or damaging solution into the vein, and that vein gradually shrivels, shrinks, shut down, and then your body can absorb it. Often it will take more than one treatment because we'll get a partial reaction with each session, and we treat at 4 to 6 week intervals. We're always going for 100% clearance, and often can, in the most severe cases, might get 75 to 80% improvement, but often we can completely eliminate the unwanted veins. Patients always want to know, does it hurt to have sclerotherapy? We are using a needle, but it's very tiny. The solution injected can feel a little bit sticky and stingy. Some patients act like I'm not doing anything, others are a bit uncomfortable, but the discomfort is very short-lived. Within a few minutes after an injection, you don't feel a thing at all. After treatment, you do wear compression stockings, and I find that as the patients put the stockings on, usually they walk out feeling quite fine, or just a little bit of minimal discomfort after. After treatment, patients resume all of their normal activities. What we don't want is jogging, Zumba, cardio, like spinning, and usually that's for 2 to 3 days. They're going to wear the compression for 2 to 3 days, and then sometimes during the day a little bit longer depending on the severity. One of the reasons I really appreciate the opportunity to treat patients' leg veins is that at least half the year people have the opportunity to expose their legs. And whether it's wearing skirts in a professional environment or shorts as they're out playing with their family and enjoying life, or wearing a swimsuit at the beach or pool, if you have leg veins, it makes you feel uncomfortable. And most people don't like the reddish, purplish, or slightly bulging discoloration of veins. And so it really makes you feel more comfortable and confident in your own self that you're out there without these funny veins and people aren't asking you what's on your leg or what happened or how did you get that bruise. So it's very rewarding. And I had one patient who told me she had not worn a swimsuit since college when someone pointed out her leg veins. And so after I treated her and cleared up her veins, which were pretty significant, she actually bought a swimsuit and took swimming lessons. So that was such a dramatic example of how treating something like this can really improve your quality of life.